recorded, please do drop off at this moment. Thank you. I'll give you a few seconds to do so. All right, we will go ahead and get started. Welcome everyone, and thank you for attending this breakout session. My name is Jana French. I am a project coordinator at the National Indian Health Board, and I'll be moderating today's session. We're really excited to have Jana French here from Crisis Text Line to present. This session will be from 2:30 to 3:30 p.m. Eastern Standard Time. Again, please be aware that this session is being recorded. All participants have been muted, and please do keep yourself muted until the end, where we will do a Q&A. At that time, you can either put your questions in the chat box or you can unmute yourself and ask your question that way. As a reminder, please do be sure to sign out and complete the evaluation form in order to secure your CE credits. That goes for every presentation for today. Just be sure to sign in and out. And I do want to give all of our time to our presenter today, so I'll go ahead and turn it over to Jana.
Hi, thank you so much, Jana. I'm so happy to be here with you all today. My name is Jana. I use she, they pronouns, and I am the Community Partnerships Director at Crisis Text Line. That covers our work with nonprofits, with local and state governments, and with educational institutions. So I'll be talking a bit about how Crisis Text Line works in general, a little bit about our partnership with the Northwest Portland Area Indian Health Board, which I know y'all are hearing from Colby next, so I won't go too much into it, but just really excited to be here with you all today and give you kind of an overview of how Crisis Text Line works. So my presentation should only take like 20 to 30 minutes of our time, and then we would have plenty of time for Q&As. Awesome. So we're going to cover how Crisis Text Line works, a little bit about our data, and then, like I mentioned, our partnerships. So at Crisis Text Line, we envision an empathetic world where nobody feels alone. We provide free 24/7 high-quality text-based mental health support and crisis intervention in both English and Spanish. We'll talk a little bit more about our Spanish service, but to give you an overview, it's a fully acculturated service. So whenever somebody texts us in Spanish, they're being connected directly to a bilingual crisis counselor who's overseen by bilingual staff. They've gone through a different bilingual training, and that's something that we launched in the last year. So it's coming up on a year of us having it. And the way that it works is anybody in the country can text hello to 741-741 for support in English. We're also available in WhatsApp as well at those two different numbers. So when someone reaches out, they are getting connected with 3 levels of support. So we have our crisis counselors. These are our volunteers who are going to text back and forth with the person, really listen to kind of what's going on in their lives and help them figure out some good next steps to move through this crisis. Our crisis counselors are always being overseen by one of our supervisors, who are our mental health professionals on staff. They can see every conversation that's happening message by message to really give the crisis counselor support and then take a more active role in situations where somebody might be at imminent risk. We serve people who have any kind of crisis. So it can be literally everything from I'm having a horrible day at work and I just need to vent to somebody. My friend's tired of talking to me about this, to I am failing my math class and I'm afraid to tell my parents, to I'm thinking about suicide, I'm experiencing domestic violence or other more imminent type issues. We see the whole range. And so when somebody texts in, they send a word. The word that we have with the Northwest Portland Area Indian Health Board, this really makes sense for everybody who identifies as Native to use, is text Native or text the word Indigenous. So they text us or they send us a message, and they're going to start by getting an automated message back. And that message says, you know, you connected with Crisis Text Line by continuing your consenting to our terms of service, and it has a link. And then it has a sentence that's in Spanish to tell you how to switch to our Spanish queue if you didn't use a Spanish word to get connected there already. And then it asks, what's your crisis? So that next message really tells a little bit more about what's going on, is run through a machine learning algorithm that we've built that helps us triage our texter queue. So it's learned the words that people use when they're at most imminent risk, and then it's going to put those folks at the top of the line. So kind of like in a mental health emergency room, where they would see, an emergency room would see somebody who has a bullet wound over a sprained ankle. That's kind of what we're doing here. Our goal is to connect with all of our texters in less than 5 minutes, which we're able to most of the time. So then from there, folks are going to be connected to one of our volunteers. These are people who are all across the country. They go through 30 hours of training and a background check. And the training covers things like active listening, empathy, collaborative problem solving, risk assessment, things that can be applied to a lot of the different crises that people reach out to us about. And it's really neat because they're like, you can be at your house, logging in on your computer. We have volunteers of all ages. A lot of people use it for putting it on their resume to get their next job. And we find that the skills that they learn in the training are really applicable for folks just in their everyday lives. Like whenever somebody starts a crisis text line, they have to go through the training, and I use a lot of the active listening stuff and the strength IDs that we teach whenever talking to my friends and they're going through a hard time. So it's kind of a good win-win situation all around. So they're going to be talking back and forth with the text, or not talking, texting back and forth with the texter over a period of about 45 minutes. We're going to start by building some rapport, really trying to figure out what's going on. We do a risk assessment for every single one of our texters where we ask if they're thinking about suicide, even if they are texting us just about their math homework. And we find that about 2 to 3% of our texters are experiencing an imminent risk crisis. I'll talk a little bit more about, but for the most part, folks aren't. And in those situations, what we do is really identify the goal, what they need from working with us, do some collaborative problem solving to move them towards that goal, and share a resource if they need, and then wrap up the conversation. So while that crisis counselor is texting back and forth, they're being overseen, like I mentioned, by one of our supervisors who are our mental health professionals. And for most of our conversations, they're just saying, you're doing a great job, or it seems like maybe your texter is spiraling a little bit, like maybe try bringing them back to discovering a coping mechanism that works really well for them, rather than really being stuck on the problem. But then in those conversations where somebody is at imminent risk, they are flagged right away. They'll probably kind of already know this is where the conversation's going, but this helps them know that for certain we asked all the questions. And for us, that means that somebody has ideation, plans, means, and a 0 to 48-hour time frame for attempting suicide or another act that would cause harm to themselves or somebody else. And in that situation, the supervisor would work with the crisis counselor to try to create a safety plan for this texter. So, would you be willing to wake up your mom? Would you be willing to flush the bottle of pills that you're holding in your hand? Something along those lines. Would you be willing to reach back out to us if you think about acting again? All of these things are what we're going to try to do to make a safety plan in those 2 to 3% of conversations where somebody is at imminent risk. And that safety plan works for about 60% of those imminent risk conversations. And then in an instance where somebody is at imminent risk and there's nothing we can do to safety plan with them, we do work with EMS to send them help that's available in their area. So it ends up being about 0.5% of our conversations overall. So I mentioned our resources. We share these out in only about a third of our conversations, and it typically can be part of a safety plan. We have a list of over 200 resources that we've kind of crowdsourced from our volunteers, from our partners, from our just people in general filling out the form on our website. And right now they're all free and national. So they fall into 4 categories. That's a typo. It's things like in the moment support or techniques that they can use to calm down. We have these nice breathing GIFs. I think everybody's seen kind of what they look like, where it's a bubble that's expanding and shrinking that you kind of breathe with just to calm yourself down a little bit. I like to call the other next step guided self-help. So there's like an antidepressant skills workbook, a coming out workbook, things that somebody can do after the conversation is over as sort of like a step towards resolving what caused them to feel like they were in a crisis. Databases where people can find ongoing care. So we rely a lot on Find Help Now, or used to be Aunt Bertha, and 211 to say, okay, if you are texting us about you are stressed out because you don't know how you're going to put food on the table for your family tomorrow, we're going to talk you through why, like the feelings around that. And then we might say, hey, if you look at the Feeding America Food Bank Finder, that might be helpful for you if you're really struggling right now and you need to find food somewhere. And then the last sort of category is online groups or forums where people can connect with folks experiencing similar issues, like in the rooms or AAs, Meeting Finder, things like that. So we take privacy and trust really seriously. For us, we make sure that our text messages don't show up on people's phone bills. We know that that's really important for a lot of our texters are teens. And so their parents might get their phone bill every month and say, okay, what are you texting these people about? You know, maybe there's somebody who is struggling with their sexuality and they haven't talked about it with their parents yet. We wouldn't want them to find out from a text message conversation on their phone bill. We also worked with the 4 major carriers to make sure that our conversations with us are free. And if folks have a plan with another carrier, we count like a regular text message. And we have WhatsApp now as well, so people can connect with us that way. And then we applied GDPR standards to everything that we do when it comes to, you know, our platform and any data that we're collecting from the conversations. So I have a little bit about our data here, our data trends. So we're the largest crisis texting service in the US. This is data that I pulled earlier this month. So we've had 7.5 million conversations. Right now we see about 3,500 conversations a day. That's from 3 million texters. So we find that people do reach out to us more than once. So conversations, we're talking about every time somebody's reached out, texters is like unique phone numbers of people that have reached out. We know that we've created safety plans and done de-escalations in 72,000 of our conversations. We find that 60% of our texters share something new with us, which is a metric that we track because we like to think that crisis text line is a stepping stone to getting more continued mental health care and opening up about difficult topics. 87% of our texters say that they found their conversation helpful, which helps us understand like if the service is working or not. And then we know that 72% of our texters identify as 24 or younger. So a little bit about where we get this data, it comes from 3 places. So when somebody texts into us, we automatically get their phone number and their cell phone provider. And that's the information we would use if we did need to do an active rescue where somebody's at imminent risk and we aren't able to de-escalate with them. So like that only applies to about 0.5% of our conversations, but in all of our conversations, we use the area code and then the next 3 digits of the person's cell phone number to help us understand like where in the country people are using our service from in general. What's really interesting is, so I'm from Atlanta, but I live in New York now, and my phone number is 770-324. So 770 puts me in the Atlanta area, and 324 puts me in like in one of the northern counties in the Atlanta area. So that's just how fun fact about how your phone number works. And so every year we put out a report about our data trends. This is our United in Empathy report using 2021 data, came out in the end of May. There's a link here and I'll be putting it in the chat whenever I'm done talking. And this kind of shows kind of what our conversations have been, the topics of our conversations over the last 3 years that we've done this report. So you can kind of see that in 2020, COVID-19 was a massive conversation and less so in 2021, but we're still seeing a lot about that. Anxiety, depression, relationships, these are the things that people text us about often. As you can see, suicide is just is smaller than those. We find that maybe like we're a little bit more upstream than other places because we see a lot of broader, like I'm feeling sad, but I'm not to the point of thinking about suicide. We also see people text us about self-harm, grief, eating disorders, physical abuse, all make up a good portion of our conversations as well. A lot of our texters do identify as, I lost my train of thought. The other places we get our data from. We also get it from 2 surveys that our texters and our crisis counselors fill out. So our texters fill out a survey at the end of their conversations where they tell us how they think we did, how they feel now that the conversation is over, and demographic information they're willing to share with us. And they fill this out about 21% of the time. So it's a sample size, but given how many conversations we have in a day, we feel like it's a pretty good sample size to help us understand who's using our service. And then our crisis counselors fill out a survey at the end of almost every conversation where they check off the topics that were covered. So that's how we track this information. And then the 21% of texters is how we know kind of the gender identity among our texters. So we do find that a lot of people who reach out to us identify as women or girls in the end of their conversation, but that people of all identities do reach out. And then when it comes to race and identity, we see that 68% of our texters identify as white, 14% identify as Black, 19% identify as Hispanic, Latino, or of a Spanish origin, and about 4% of our texters identify as American Indian, Alaska Native. And then we also see that about half of our texters identify as LGBTQ. Last year was the first time it was the majority of our texters. Actually, I think that's a typo, but it was 51%, whereas 49% for 2021. And then we like to use these data trends to help the field in general kind of understand what's going on. We know that it updates every day. And so we know that we have really up-to-date information about who's reaching out for help. What are they really struggling with? It helps us track things like the first week that the US kind of shut down around COVID-19 back in the middle of March in 2020, we saw a spike in conversations. Right now, we're seeing that people are texting us a lot about going back to school, particularly teens and eating disorders has been coming up a lot in our data over the last 2 years or so. And then we share these out because we want people to kind of know what's going on in their communities and make decisions using our information around research, policy, and public health. And then this is a little bit about our methodology that I left in here. This is kind of what I was explaining on how not all of our conversations, we have the demographic information, but we do have a good sample size for that. So I'm going to talk a little bit about our partnership with Northwest Portland Area Indian Health Board. So they are a nonprofit organization that serves 43 federally recognized tribes of Oregon, Washington, and Idaho. Thrive is the suicide prevention project there, and it's housed at the Northwest Tribal Epidemiology Center that provides research, surveillance, and capacity building assistance on behalf of their member tribes. And the goals and the projects that we work on, the studies they collaborate on, are much more all guided by the 43 Northwest tribes. So we've been working with them since 2020 to try to understand how we can connect with more folks who identify as Native and make our service more appropriate for Native texters, making sure that we have the best information that we can give to our crisis counselors so they can provide the best service to folks. And whenever somebody texts into us using Native or Indigenous, it comes directly to us. So they're going to have the same sort of experience that I had outlined earlier in my presentation. But what it does is it prompts our crisis counselors to refer to a tip sheet that we collaborated on with Northwest Portland Area Indian Health Board, Indian Health Services, and with Shelby Rowe, who I know is now at SPRC. I can't remember which was at the time we were working on that specific tip sheet though. So it has things like, remember that colonization is a thing that it may be affecting texters and is an underlying current of what could be part of this crisis. Here's what not to say. Here's some phrases that might make people who identify as Native feel more heard in these conversations. And then here are specific resources that would be more helpful, like NICWA, Strong Hearts Helpline, the IHS Service Finder. And then we share back with Northwest Portland Area Indian Health Board, a dashboard of anonymized and aggregated trends that kind of just let them know, here's how people are using this keyword. Here's how many people reached out in the month of June. And here are the kinds of topics that they're reaching out about. And then I have here some of the materials that they've created as part of our partnership. I don't know if you all can hear, but there's like some nice music in the background of this. Yeah, so, and I know that y'all are hearing from Colby next, so it didn't include too much, but here are just some additional links on kind of our service and how to get in touch with me, and then some links for Northwest Portland Area Indian Health Board. So that's the presentation that I have for you all, and I'm just open to answering questions and anything else that I can tell you all about Crisis Text Line.
Thank you so much for that, Jana. I always love, listening to your presentations and just seeing the updates that you get monthly on, the demographics and who's responding and what they're responding about. So thank you so much for providing that. If you guys have any questions, you can put them in the chat box or feel free to unmute yourself.
Oh, and Angela, I see your question. Anybody can use Crisis Text Line. If folks use that either Native or Indigenous when they text into us, then it just kind of lets the crisis counselor know that this person identifies as Native. But it'll be the same sort of experience no matter what. I mean, you might have seen a lot of different keywords. You have like about 160 partners, organizations, and they all have different words like text NAMI, text MHA. They all come to us and we all answer them all the same way. That just is how we can provide a little bit more information to our crisis counselors about how this person is finding us and what they're maybe a part of their identity that would be helpful for us to keep in mind and make the service more appropriate for them. And it also helps us understand the data trends. So if you leave your phone unlocked in your pocket and text us a string of letters and numbers, we're still going to be like, hey, how's it going? Do you need help? So anything you text us, we'll respond. Christy, we do have partnerships with a couple of other tribal organizations. I work with Great Plains Tribal Leaders Council, and I work with Osage Nation and with Muskogee Creek Nation. So they're just separate partnerships. Our one with Northwest Portland Area Indian Health Board is the most broad, but we do have other organizations that we work with across Indian country. Sunny, I have some, I'll find some links. We have mostly digital templates that you can take and put on social media, or some like posters that you can just print on your office printer, or if you have a printer that you like to work with. But we don't have very many like tangible objects. We have a store, but it's got a lot of like nice things for our volunteers, as opposed to things that would be helpful for promotion, if I'm being honest. Jessica, no, it's not. Anybody can text us, no matter how they identify, even age. Like we have texters who are younger than 13 and texters who are older than 65. So really, we serve anybody, anywhere. And just if you use Native or Indigenous, that'll let us know that that's a part of your identity you want us to take into account, and then it helps us share information back with Northwest Portland Area Indian Health Board. Yeah, let me find you all the links for some promo materials so that you have them. We just put out a back to school kit. So it's let me find it and I'll share my screen again with that. Okay. So if you go to this page on our website, and I'll put it in the chat, this has some neat tools we put together for students, both teens and college, for back to school. We launched it earlier this month. There are posters that you can download and print out. These just have the school keyword on them. And then I think that Colby, in the links that are at the end of this, there's places where you can download things that specifically have the Native keyword in them. And then we can also customize a lot of our stuff with whatever keyword. But this is really neat. It has little tutorials on connecting with your senses, writing out your feelings, making a plan for mental health now at the beginning of the school year, before things get too hectic and finals add up and you've got 6 homework assignments due in one day. And then we also put together guides for talking to your parents and your other family members and friends about mental health. Something that we found with launching our Spanish service is that the people reaching out to us are more concerned about how do they talk to somebody in their lives about mental health. And so all of these are available in English and Spanish too. And then this link is our United Empathy report. This is some of the data that I presented from. But it'll tell you kind of by state and by nation, across the nation, where folks are reaching out to us from and what they're reaching out about. And then Sunny, in here, there is a place where you can buy, but these like stickers and business cards, but I think that they're kind of expensive. And so I would recommend just downloading what we have on the website and printing through your favorite printer, just to be honest with you. Thanks, Christy. I'm glad that you have it, and I hope it's helpful. And if you have any questions or more information or more resources that you want, I'm happy to share them with you. Oh, thanks, Nathan. And I want to say too that we are always looking for more volunteers. So if you are looking for a volunteer opportunity, or somebody who's looking for a volunteer opportunity, it's pretty easy to become a volunteer. You can apply on our website. We have a 30-hour training. But like I mentioned, the training does cover a lot of things that can be helpful whenever talking to somebody you love, somebody you care about, somebody you don't care about. I use this when I talk to people on like customer support too. And it's all online. So the training is online and the volunteering is done online, and folks log into our platform, which we built on our own. It's at like a specific web address, and that's how, it's not like you're texting back with somebody on your phone. You're on a website. It kind of looks like old school AIM, where you on the side, you've got like everybody else who's online with you, and then your supervisor, because when you log on, you're matched with one supervisor who's online, who's going to oversee all of your conversations. They'll reach out to you and say, hey, hope you're having a good day. Thanks for coming on the platform. And then that's how they'll keep in touch with you throughout the conversations. And then we find too that like people really like the community of volunteers. And so they'll pick a day where they know that their other fellow volunteer friend is going to be on, so they can have a chat with them going too. It's really nice. We like it. We have some channels that we encourage our volunteers to use while they're volunteering, where they can debrief a tough conversation, or they can say, hey, I have a texter who's texting us about eating disorders. Which resources do you think would be helpful to share? Oh, Sandra, glad to hear. And Marilyn, I'll take down your number. I'll give you a call. I'm happy to give this presentation to whomever, because I want everybody to know about the service, everyone to know about our partnership with Colby and friends. So I'm trying to take it down.
And I did want to reiterate, this session will be recorded and posted onto our website, so don't freak out. You'll have all of these links in Jana's presentation on our website, so you don't have to, copy and paste and lose track of the links right now. So it will be posted on our webpage. Oh, Carrie, did you have a question? Maybe not. We do have about 30 more minutes allotted for this time. No worries, Carrie. So if you have any more questions, feel free to unmute yourself or put them in the chat box.
I can tell you all a bit about, and then stop me if anybody has any questions. Sometimes I give these presentations and there's tons and tons of questions. We run out of time, so I try to leave a lot, but then sometimes folks are like, excellent, straightforward, and then there's not a lot of questions. We are running an United Empathy campaign through the rest of the year. So what we're doing is we're putting together some touch points like these mental health school supplies, where we're encouraging organizations to sign up and help us to distribute just different resources and different parts of our toolkits to the people that they serve. Let me find that link for you all. We would love to have all of y'all sign up. It's going to be, this is just the first touch point, is this mental health school supplies. But after that, we're going to be doing things for World Mental Health Day. Around the holidays, we always do a Giving Time campaign. So we obviously do Giving Tuesday too, but we find that folks have a little bit more time around the holidays, or they want to give back some more at the end of the year, so that we encourage folks to come on and take our training then, and sign up. Let me share my screen again. Here's the link if you want to sign up to be like a partner organization to help us really spread the word. So it's pretty easy. I'm not asking, it's like not a big commitment. We're just, trying to unite organizations to help us find new volunteers and help more people connect with our service so they can reach out whenever they need help, and really help people understand that we're here for, like I mentioned, everything, that it doesn't have to be your worst day ever to reach out. It could just be that you just need somebody to talk to. And I always share that in the times that I've reached out personally, like one time my cat was really sick a year ago. He was in the hospital for a week. All of my friends were being so supportive. I have a wonderful support family. I'm in therapy, all of this stuff. And I still was up alone at 2 a.m. really stressed out about this. And I was like, you know what? I think I'm going to reach out. And it was really helpful, even though I kind of know the secret sauce, but I found it really helpful. Yes, Sean, we do have an affiliate in Canada. So we work with Kids Help Phone in Canada. That's also 741-741 or 686868. And I know that Kids Help Phone does a lot of other programming as well, but they run kind of like our service in Canada. They're an affiliate. So it's a little bit like a McDonald's, but we love them up there. And Christy, I think that for us, what we're doing is we're mostly kind of listening to what people are experiencing and helping them de-escalate the crisis that they're in. The resources that we share do include like the IHS service provider, and I don't think that we have any feedback directly from a texter who we shared that link with, and then they had some sort of different, because we're kind of hands off on that, where we would share the link and say, I hope that this is helpful for you to find the service that you're looking for. And then from there, it's kind of in their hands if they want to reach out, if they decide they don't want to reach out. So I don't know if we have, if I have much of an experience on that to share.
Any other questions at this time?
Oh, and let me put my email in the chat so y'all can reach out to me, and then maybe we'll just give you all a little bit of time to eat your lunch if that's where you are in the country, eat your afternoon snack if that's the other place you are in the country.
Yes. If we don't have any other questions, we can give you guys about 30 minutes back. The next session will start in 30 minutes, 45 minutes, 40 minutes. I can't do math today, but it'll start in 40 minutes at 3:45 Eastern Standard Time. But if we don't have any additional questions, I just wanted to thank you again, Jana. I always love hearing your presentations, like I said, and I really thank you for joining us today. And thank you so much, everyone, for joining the session as well.
Yeah, thank you all for having me. And yes, please reach out. I'm happy to connect on any and all of this. All right, take care.